Anything exciting in the metastatic realm other than immunotherapy?
So at the ASCO 2016 meeting, there was an interesting abstract that I certainly did not see coming. There is a different class of agent, targeted agent. It's a pill that you take every day by mouth called Buparlisib. It's a so-called PI3K inhibitor. And I just will give a very quick explanation, but essentially cancer cells need certain ways of staying alive. And PI3K is one of those ways of staying alive. And trying to block this, inhibit this with a pill like Buparlisib has been thought to be very promising for long periods of time, literally for the last 5-10 years. But nobody really figured out how to do it. But at this meeting, I think we actually found out how to do it. And the way is, surprisingly to me, to give it with a mild type of chemotherapy called paclitaxel. And so it was a trial that randomized, so it actually took two types of treatments, either just the chemotherapy, just the paclitaxel, or the same treatment, paclitaxel, plus this new treatment, Buparlisib. And the results, in my mind, were actually striking. There was an improvement in what we call progression-free survival, a measure of how well patients do, how long they live, by about 4 months. And I thought that was striking data. I think it's still relatively early, but I suspect, again, as was pointed out, in a situation where you have nothing else to offer, this looks like a big improvement, and I suspect that we'll see more data in that regard. It's also a relatively well-tolerated agent. It's not chemotherapy. So I was excited about it. I'd like to see a little bit more data, but I think it's another new mechanism that might actually help patients with head and neck cancer.